when we do the blood work and then we see that, oh, you're probably at a quarter tank here, I want you at a 3/4 tank here, up towards the top. And then the overall benefits of each one of those vitamins, you look it up on PubMed, is just for preventing cancer. This one, you could look at every single one almost and see just probably 10 things that it can help with or help prevent.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Deiser. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome to Personalized. Today we're speaking with Dr. Clark Gaston. Dr. Clark has an extensive background in baseball, football, and Olympic weightlifting. A native of Cleveland, Tennessee, Clark was a standout baseball player in high school, batting over .415 as a sophomore. He also played football, his first love, and went on to play at the University of South Carolina. He was ranked 4th in the country by ESPN as a fullback. He played both at South Carolina and Wofford College, where he went on to help them win a Division I AA Southern Conference championship. Dr. Clark decided to move on to medical school after the NFL lockout in 2011, which took him to Arizona. Dr. Clark then competed at a local weightlifting meet as a 105 kg in February 2015 and won first place. Dr. Clark's a licensed naturopathic medical doctor currently practicing in Arizona. He primarily focuses in regenerative medicine for pain, hormone replacement, and peptides. Enjoy our episode with Dr. Clark. And I'm here with Dr. Clark Gaston. How you doing, Clark?
I'm doing great, man. How are you, sir?
I'm good. Thanks for being on the show today.
Thank you for having me.
We got this really cool show where we're talking about personalized care and individualized medicine. And when we were preparing the lineup of, for the first few episodes, we thought of you because you've got something different, something that not many practitioners are doing in my region especially. And so I'm super interested to talk to you today about what you've been up to and how you've been supporting people.
Yeah, man. I feel like Vitamin Lab, just a brief history, I think I've been using Vitamin Lab since 2019. And at first I wasn't using it as personalized as I am now. Like at first I was going through a lab and I think we were using an IGS system. I think that's what a lot of practitioners still use. I'm actually thinking about talking more with Carolina about another type thing where I can basically integrate kind of the IGS portal type thing in with more of what I do. But right now I'm working through Vibrant America. They're out of California, and basically still like manually putting in a lot of things through Vitamin Lab. So basically was saying that like I've kind of changed up over the years with what I've done with Vitamin Lab, but it's like today even I saw that Vitamin Lab's like moving in magnesium threonate. I don't know if you saw that yet, but that's another vitamin I've been prescribing separately from what I'm doing with you guys that I'm super excited about. Yeah, so I guess I've changed up over the years while I've been working with you guys, and I'm super excited to keep moving forward with you guys and providing the tailored care that we're here to talk about today.
Awesome. Oh, that's super cool. Thanks for that. Yeah, I have my custom formula at home, and my favorite thing about it is that it's ridiculously potent because I got to make it for myself. So the dosing strategy that I'm using is intense.
Yeah, and that's another thing I've learned is like I've actually put a little too much vitamin C and magnesium in some of my patients' formula, with which that can lead to basically going to the bathroom a lot. So that's I'm always learning, and I feel like ever since I've started doing Vitamin Lab or vitamins in general, I've been with Vitamin Lab and learned a lot ever since. So I learned just as much from my patients as I feel like they learn from me. So
there you go. It's a good way to be, right? Tell me about how it started for you. Like we'll get to where you are now, but what got you into naturopathic care?
I will say that was my father. Originally, if we go back in my history, I played college football and basically majored in biology, so that was really tough. And at about my senior year, we found out my dad, he had a heart attack, And then when he was at the hospital, we found out his white blood cells were like 3 times the upper end of normal. And basically, that started my whole naturopathic journey, because he wouldn't take his medications after the heart attack. And they told him basically, your dad has something else going on, either heart disease or excuse me, cancer or HIV. Well, they tested for HIV. It wasn't that. So the next thing to do was to find out what type of cancer he likely had, or, I mean, they thought it might have been a serious infection, but not basically to the extent of his white blood cells were that high. So he wouldn't take his meds. That started my journey, basically trying to figure out how I could help him naturally as possible through diet, exercise, supplements, and all that. And we actually had really good results getting his cholesterol levels down. He had a bunch of weight loss. I think this was like December 2009, and then 2010, basically all that spring. I think he lost like 40-something pounds. His cholesterol improved. He felt a lot better. He didn't want to take all the meds they put him on. And it wasn't long after that we started dealing with oncology. And we figured out he had, they called it CLL, chronic lymphocytic leukemia. And then eventually later we found out it was actually SLL, a more rare form of cancer, a small lymphocytic lymphoma. And it kind of manifested in his neck here. But with saying all that, we went through a lot of doctors, and then we always heard a lot about Cancer Treatment Centers of America and how they provided individualized care. And we actually never did that. It always sounded good. I started at naturopathic medical school in 2012, and he started radiation that year. He kind of waited a little while and tried to fight it naturally, because we thought it was CLL. Basically, there's a watch and wait period associated with CLL before you begin treatment, oftentimes. And so I eventually got him out to Arizona when I started naturopathic school at SCNM. It's now Sonoran University. And I was driving him while I was in med school up to a place in Cave Creek, north of Phoenix area. And we were doing a different alternative type chemotherapy, where they were using 5 different types of chemotherapy called IPT, insulin potentiated therapy. And I talked to a lot of those docs. A lot of those were MDs doing this. And basically that started the whole process of me thinking of individualized care, because they were doing something very different than the conventional model. They were doing IV therapy. They were doing 2 separate days a week, and then 2 days a week he was doing the chemo, and then he had 5 different types of drugs that they were basically using to try to target the cancer cells dividing in the cell cycle and all that at different areas. And I learned with all my research in cancer that there's many different types of cancer. It's not just the cancer, as a lot of folks back south would say. There's a lot of different types, and they all behave a little differently. And the drugs that they use are a little different, and then how they target those cells dividing at different times in the cell cycle is different. So that started the whole process there of my thinking of individualized care. And to me, with a sports background, it just always made sense to check like vitamin D levels. I was listening to Mercola, Dr. Mercola, or watching his articles way back in the day too. So that all kind of started it. I know that's kind of long-winded, but I feel like I had to, tell you all that for.
No, totally. That's important. Gosh, it's such a common story, right? Like, you get a few other people I spoke with this week. That's exactly how they got into this medicine too. Some family member needed support, or they needed personal support. For me too, my wife's my father-in-law, my wife's father, had mesothelioma, and he worked with an apothecary back east in Canada. We have apothecaries. There was no real naturopaths at the time. He was working with an apothecary and getting good benefit from the formulas that were being provided for like a side effect reduction from chemo, and that was quite inspiring to me too.
That was a big part of it too. Yeah, the side effects that a lot of the conventional doctors, they don't have anything for you. And for my dad's case, he had a lot of mucositis, and then so we started looking into how to manage that, and that was just hell, to say. And then all the symptoms, and then we saw other patients that were going through so much, and they had their own unique symptoms that unfortunately the conventional model didn't have much to offer them, but naturopathic things like acupuncture, and I'll just have to say even medical marijuana had a big role to play in not just my dad's care. He had to go back to Tennessee, and it wasn't legal over there, medical marijuana
Hmm.
at the time. But I've seen, I've helped a lot of folks out here in Arizona with medical marijuana that were going through a lot of the stuff, mainly the nausea and the muscle wasting and all that stuff, and getting an
Absolutely, yeah, it can be so good. We're not allowed to prescribe it here in British Columbia. It's not part of our,
Mm,
it's not within our rights. However, people use it recreationally and
right.
experience benefit in their because it's legal completely and experience benefit for side effect reduction that way. But you're permitted to use it there pharmaceutically.
Correct. Yeah, it's recreational and medicinal here. It's been
Excellent.
medicinal, I think, since 2011 or 2012. So
Oh
it's been,
wow.
yeah, medical a while, and then it went recreational, I think, 3 years ago.
So did you ever think you were going to focus on cancer care? Did you ever think that was going to be your career?
I did for a while, and to be honest, you know, I just after losing my dad, it wasn't for me.
Yeah,
It's
right.
tough,
I
man.
hear
That's a
you.
tough road. That's tough.
Definitely. I totally hear you.
And that's another thing, I talk about my colleagues that are in that line of work. I'm just like, who's taking care of you, because it's a lot. Because, that's the thing we do as physicians is, um, we're right there bedside with them, so, and,
Definitely. Yeah, no, I hear you completely. I thought I was going to be only doing sports medicine. I thought that was going to be my whole thing, and then turns out the first 5 years of my career were like just integrative cancer care.
really,
Basically
yeah,
just yeah, just that. And it's tough. It's a tough
yeah,
profession to be in. You're playing a supportive role mostly here, right? Like IV therapy, nutrition therapy, exercise therapy, trying to reduce side effects, but still, you're the person that they spend the most time with on the medical team really when it comes
right,
down to it as the naturopath.
yeah, yeah.
So you went through that, and that must have been a big time challenge. And you're coming from an athletic background, and did you then like transition right into like I'm gonna see as many athletes as possible and help as many athletes recover from their activity?
Yeah, I guess, my dad played some college football, and I guess my thinking when I lost him was just, how do we prevent this hell on earth from happening, as much as possible? And so that kind of led me, it was like, well, I got a sports background and I love to exercise and I love to inspire others to, do the same and get healthy and fit and exercise and um, do whatever we can to prevent cancer or any chronic illness that, can be prevented, which we can't quantify, right? It's hard to quantify, how many cancer cases were prevented from, going to see a naturopath or, losing that extra 30, 40 pounds and what that did for your confidence and then what that did for your job and then what that did for your mental health and your physiological health and all that stuff. So it's super hard to quantify, but that's kind of where Strength Doctor, I was looking that way. And of course, I was super hopeful that I could save my dad and find something revolutionary, that's going to change cancer treatments forever. And I guess part of that was a little traumatizing when I didn't, I felt like I didn't. So, how do we prevent it? And that's where Strength Doctor came in. And yeah, that's kind of my thought process there. So,
Wow, wow. Okay, I get it. I get it. So you transition to the strength doctor path, mostly in prevention, and
mhm.
and do you sort of focus like right away on just nutrition and exercise, or do you get into injections at that time?
Right. That's where individualized care comes in. So if somebody comes in and, my right shoulder, I can't work, doc. Like this is my main concern. So, but, that right then and there, we're going to address the shoulder pain. And right now, I was doing some physical adjustments, or not chiropractic, excuse me, acupuncture, like scraping, gua sha, that sort of stuff. Now I'm just doing regenerative injections, and people know that when they come to see me. They've usually already tried that stuff, and they've only got so far with it. So basically, if Jim comes to see me and he can't lift his arm and he can't work, we're going to address that directly that day. And if he already knows, he's been on the website, he probably knows he's coming in to get PRP, or at least hear about it. We don't have to do the injections all in the same day. We could do the consultation, which clearly I'm going to get a detailed history, see if he's had surgeries before, what he's tried, all that that we know how to do as naturopaths, and then physical exam is extremely huge for me, finding out what I believe to be the pain generator, and then basically coupling that with an ultrasound exam, and then talking with the patient. Here's what I think's going on. Here's basically what I think can help you. Of course, there's no guarantees with PRP or anything in medicine, so I'm very real about that. And I feel like for the most part, patients do appreciate that. Just me being super real about all of that. And then whether or not they decide to go ahead and go through with that the same day or not is up to them. I'll leave it up to them. And then, so
Love it.
yeah, saying that, I also mentioned, I would recommend, Jim, you're 52 years old, that we also follow up with some blood work if you're not, you haven't looked at your testosterone. And then what's your vitamin D? Have you got that checked? Well, maybe once long ago. So I'm also basically recommending that they, come back and see me for blood work after that, Ideally before, right? Ideally they're healthy coming in, but, I do see a lot of, I do a lot of men's health. And as we know, a lot of men, they wait till they can't work anymore, and that's when I see them. So get them out of pain, get them in physical therapy, and then get them coming back to do detailed blood work is kind of how I roll. So.
Love it. Love it. Can you tell me a little bit about PRP, just for the practitioners listening? Like myself, I've always thought, okay, I'm going to get into regenerative injections. I'm going to be doing this type of pain reduction and speeding healing therapy, but I never have. And I'm wondering if we have a practitioner listening who's like in my boat and considering going into this. What could you tell them? What could you share so far about your experience?
Well, I think as naturopaths, like PRP is like the ultimate naturopathic thing for pain management to me. You're using the body's own blood and the platelets within the blood to heal. So, was saying that, it starts with a blood draw. Clearly, we do the consultation. I give the patient, if it's not, say they've got a torn, supraspinatus, right? Very common. If it's completely torn, I'm not going to recommend PRP, right? So they need to do surgery, unfortunately, if it's completely torn. But if it's a mild tear, grade 1 tear, then I would recommend, hey, if you don't have any pre-existing conditions as far as like blood clotting disorders or so it's not exactly for everybody what I'm saying there. And then diabetes, clearly we know diabetics don't heal as well. You're still using the body's natural healing ability to heal. So the process is, I get long-winded, sorry.
No, it's good.
Yeah, the process is, they're going to come in and then we're going to do all the exams and all that sort of thing. We're going to have a talk and then we're going to do a blood draw. So that's just from the arm, and then I take the tubes and then centrifuge those, basically separating out the red blood cells from the platelets, and then I draw the platelet-rich layer out of the tubes and then inject that back in. I do have I have two different basically formulations, and I don't always see the ultra concentrated PRP version as superior, especially in like younger athletes and going into some joints. I don't really think, basically there's all these kits. What I'm saying is for everybody, all the docs out there looking to get in this, there's all sorts of different applications for different concentrations of PRP. To me, getting PRP in there and in the right spot is extremely important. So using ultrasound guidance is extremely important. So basically, pulling out the platelet-rich layer and then injecting that back in, and it's basically mimicking your body's healing response. So if you get into a car wreck and say, this is what I tell my patients, and you're bleeding, really bad, you've had a big laceration, it cut through skin, muscle, nerves, maybe even chipped bone, cracked bone, your body has an amazing ability to heal all that, and the first thing your body does is stop the bleeding. So that's platelets aggregating at the site of those blood vessels that were severed there. And then over the next days, weeks to months, your body has an amazing ability to heal ligaments, tendons, bone, cartilage, nerves. Platelets are what signal a lot of that. The growth factors in platelets and the bleeding itself signals your body to go to that exact location to regenerate, all those sort of things.
So cool. What ultrasound machine do you have?
I've got the Clarius.
Clarius. I see advertisements for that all the time. I think, oh, geez, that sounds so cool to have one of those and be able to do this therapy.
And then yeah, you've worked with athletes too, right? And you're into like optimizing like VO2 max, right? And are you do
That's
like
correct.
point of care stuff too, or like on the spot?
No, I don't.
Yeah.
Do
Well,
you?
the ultrasound. Well, I do. Yeah, I go to a local gym, UKF Ultimate Combat Fitness. They're in Mesa, and there's a
Okay.
lot of MMA guys over there. And yeah, when I can make it over there, there's always something going on with those guys,
Yeah,
right?
right.
Just, and I started boxing myself, and so when I go over there, it's usually anytime I'm over there, I'll try to have my ultrasound with me because
Nice.
somebody just sprained an MCL or
Yeah.
tore a ATFL on their ankle, and so we're looking at it, and then of course I'm telling them like I don't think you can fight in a month, and then they're just like what?
Ah,
Sometimes they don't listen. Yeah, even some of my patients don't listen, but no, yeah, I do try to do some of that.
that's cool. You're walking in there with an ultrasound machine. I love that. They
Yeah,
must love that too.
yeah,
That's amazing.
they love it until I tell them I don't recommend you fight.
Yeah,
This.
exactly. Come on, get out of here. Why are you coming around?
Yeah, I thought you were
How'd
my
you?
friend, doc. No,
Yeah, sure.
tell me what I want to hear. No.
I'm interested in this for young docs out there who are looking to get into like working with athletes. We're setting up a second location that's in a facility where we're told there's going to be a lot of athletes, and so we're excited
Yeah.
about that because we do this assessment right where we find limitations and then we do programming to remove those limitations. And so we're trying to get in with athletes, but I wonder like what are your suggestions for helping young docs meet more athletes and get into this type of care? You probably remember like from your school there was a lot of people in my class who were like, I am just going to see athletes. That's going to be my thing. And then not very many people have been able to because it's not super easy.
Right. Yeah. When I'm trying to think, I was fortunate in the beginning. I went mobile in the beginning,
Right.
and then I was fortunate to. I mean, I met some lady out in Old Town, Scottsdale, one night, and was just talking with her. And then, like a week later, she was referring me to a first round draft pick because he was in town, NBA draft pick, and he was in town and he strained his glute. And I was just like, whoa, this was like my first year out, and I was like, but the fact that I was mobile,
Yeah.
so I guess that would be some of my advice. You got to be flexible, you got to be mobile, and you got to get out and shake hands, and you got to talk to people, and it's tough. It's tough getting out there and meeting people.
That's a really good tip. I remember being initially out and being a little bit nervous to talk to people about what we do and what we're interested in,
Right.
because you haven't had that much experience. Maybe you've just had a year or two in the clinic.
Right. Yeah. When you get out, you're just kind of like, yeah,
Yeah.
I was there. Yeah. But I feel like more for me than anything that helped me get athletes is, you know, as you can probably tell, I'm just myself, and then
Yeah.
I played college football, and that helped me relate to a lot of football players, and then yeah, even NBA players and that sort of thing. So yeah, who you are, right? I think really plays a big part. And if you're trying to be somebody, necessarily like if you don't have a sports background, but all of a sudden, I would try to just be yourself. That's my advice, and then kind of, it's tough when you first start out because you're going to make mistakes and you really are, like anywhere from like doing adjustment a little bit, too aggressively, and maybe you hurt them a little bit. Thank goodness I haven't ever hurt anybody like, bad, where like, they weren't more than sore for a couple of days. But with me saying that is like, you guys just got to you got to get your feet wet. You got to, throw yourself out there, and it's not easy. And I was going around to local gyms just shaking hands with the trainers, and literally I printed off some Vistaprint business cards, and I would come in and I was like, can I set up a table? And then I had my brand there, and then I was just literally talking to people that were walking by, handing them out cards, just saying, I'm a new naturopathic doctor in the area. We're giving out free adjustments today. Are you interested? And I had like one of those Theragun things,
Yeah.
and,
Right.
and just to be kind and hand my card out, and then I would say maybe only 5-10% of the people would call me back, but that got me started, and
That's a good strategy. I was told initially that giving talks, like giving webinars and going out and talking to the public, didn't really have a a big turnaround. Wasn't didn't really increase the draw for NDs, but giving talks was really successful for me. I don't know what it was about it, but every time I gave a talk, I'd get 20%, 30% of the people in the crowd, they'd come and see me. Even if it wasn't for a full hour, maybe they come for a shorter visit just to sort of work on the thing that the talk was about.
Right.
That really worked well, but it sounds like you were able to get out and socialize and talk about what you're passionate about and talk about how you really want to help people.
Yeah, you got to give to receive. Yeah. And don't give too much, though. Don't give too much. At the beginning, I'm sorry, you're going to give a lot.
Yeah.
And then you got to learn to receive. But getting the ball rolling, and you're going to have to probably work another job for a little while. Maybe you work at another clinic for 3 days a week, and then the other 3 days a week, you're going to have to be working 6 days a week. I'm sorry, if you want to own your own business. I don't think owning your own business is for everybody.
Right.
So that's where I kind of like who you are as a person. Like I'm naturally, clearly, extroverted a bit. I don't have a problem going out shaking hands with strangers. So some people I get it. So what works for me is different than what works for you, and that's the same with your patients, right? So that's why we're here today to talk about all that.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Were you trained to do these injection techniques at your college? Like, was that part of your program, or did you do your training after?
Yeah, so I started at the end of my junior year. That was 2014. I started with an attending physician at SCNM. Dr. Vance Inouye was a great introductory to prolotherapy is what we did. We didn't really do PRP much. I learned that by going actually to his private practice where he was doing that there, and then learned how to do that there.
Cool. Okay.
But
wow, that's good. So was it like a mentor situation?
No, it was actually my stepdad. He came in and he had a hurt shoulder from my graduation, and we went to his private practice and saw him. And I'd already been working with him for a year, and he was like, "Here's how you do PRP." I'm like, "All right, okay."
Nice. There you go. Oh, cool.
Sometimes you got to pay to play too, right? Everything's
Sometimes
not free.
you do.
Yeah, a lot of times.
Yeah, you're the second person this week who said that. No,
Yeah.
totally. I'm a big believer in paying to advance your education, especially when it's like about like one specific thing that's going to help a very large percentage of your patient population.
Gotta
It
invest,
sounds like
yeah.
this is paid off, and you're making a full career out of it.
Yeah, it's paying off. It was. I was doing a lot of adjustments at first, and acupuncture and stuff like that. But that got people in the door. Yeah, that's the biggest thing in the beginning. You got to get people coming in the door, even if you're giving, $10 B12 shots out. Don't do that. All right, you get what I'm saying? That's too
We
cheap.
can't do that here. We
No,
have
no.
a certain fee structure we have to follow.
Right. Yeah.
But I remember driving for like an hour to my clinic that I was working in just to give one B12 shot, and then driving all the way home. Like it wasn't busy for a very long time. Just kept making the drive over and over. And then eventually it picked up.
Yeah. Yeah, where you put your intent and your energy, it pays off, and it's usually not near as soon as when you hope. But
Absolutely. So do you still do any prolo?
no, I don't do prolo. I still believe. I still hear docs saying that it helps with ligaments and nerves pretty well, but to me, in my experience, when I was using it on shift, it wasn't near as beneficial as the results I saw. So I worked with it for like a year on shift, and the results were probably, give or take, in my experience, 30% less than what I've seen with PRP after one round.
Wow.
Yeah. So I mean,
That's significant.
yeah. So to me, and people don't like getting injected either, and so to me, I'm just like, would you rather have 3 rounds or 1 round? But usually It depends, right? That's another thing to talk about. That's a big question. How many injections does it take, doc? Well, that depends on you, the patient. It depends on, yeah, your age. I'm sorry, but like, yeah, like some of these young pro athletes that are in their 20s, it's just they've got circulating stem cells in probably decent numbers still. They're in amazing shape. They recover extremely well. You get PRP in and around the area, and man, they get better. No, like, yeah. Um, but somebody that
Fast too. Are we talking about one injection?
sometimes, if it depends if it's a joint, it's going to take longer to heal. But I mean, yeah, some of these guys I've injected, they were playing 5 days later. I told them not to.
Wow.
I was like, take it easy for a couple of weeks, and one guy was out, slam dunking 5 days later. I mean, he had like a grade, I mean, a BAS score like 2 or 3 out of 10 for like a glute. But that was like one of the best games he ever had. And of course, he thought like, "Oh my God, Doc, you're amazing." But
Yeah, right.
yeah, so
Well, it sounds like it had a big impact though, because
yeah,
it was happening and he recovered fast. I love that.
yeah. So it's different. What I'm saying, my main point is like, a lady that's 65 with osteoarthritis, bone on the knee.
Hmm.
PRP may not work at all, right? Or she might get significant benefit out of 2 or 3. And that's another thing. Some of the literature does show it regrows cartilage. I don't tell patients that necessarily that it's going to regrow your cartilage. I say that it might or it could, but basically that is more the rare side if you look at the literature. Like basically they'll take, a subset of patients and then a small showed actual growth of cartilage, but usually in the benefits it's like increased range of motion, decreased pain levels, and the osteoarthritis didn't get worse after 6 months, after a year. And that's basically, I make all that very clear. So that's kind of what to expect. And then we all get arthritis as we age. So our knees, our hips, all that. So another thing I tell people with PRP is for older patients is it's beneficial to get you doing what you want to do, get you out of pain, not completely, right? We have to be, it's called pain management, not a cure, right? So we have to be careful with the language there. But it can help decrease your pain levels, get you into physical therapy again, get you doing what you love again, hiking, biking, and that sort of thing. And then we're trying to delay the amount of time that you might need knee replacements. So, yeah. That's another thing.
Oh.
You got to be realistic, and patients
Hmm.
really appreciate that. Like you're not just selling them a bill of goods. Here's PRP's place, and
Hmm.
it's not in place of physical therapy. Physical therapy is a big part of the healing too. So,
Right. Yeah, you're so right. Gosh, I'm like now I'm thinking about my future because I had I had my meniscus out when I was 14. So long jump accident, and then a secondary baseball accident sliding into second base. And so the surgeon said, you're going to have arthritis for sure. It's like, it's coming. So I'm
yeah.
trying to keep a list of what I'm going to need. It sounds like this is going to be a good strategy for me.
Yeah, I'd recommend. Yeah, definitely. If you haven't had PRP yet, trying that out. And BPC 157, you probably heard of that. Yeah.
I have, yeah. It's not part of our scope here either.
Really? Oh
Yeah, I
man.
know. I'm missing out on the scope. I'll have to
Yeah.
come to your office.
Yeah, definitely. Yeah, we'd love to help. Yeah, that's
Oh, gosh.
crazy. Man, not even BPC. All right.
I know, unfortunately. Yeah, maybe someday. So, tell me about the number the number of treatments for say like a 50-year-old male. We're talking about like 2 or 3 treatments, and a secondary question there just to add on to it would be like without objective assessments, how are you supporting nutritionally for that person?
Okay, so first question, 2 or 3 injections for a 50-year-old male depends how bad. Ligament laxity is a huge factor in the knee, say. LCL, MCL, if those are lax, the first thing we do like I never forget in football, I sprained my MCL and they put a plastic slash metal, it was like aluminum brace, so that knee would not go side to side, right?
Right.
So it's providing bracing, it's providing structural support. That's what the MCL, LCL are meant to do. Over time, some people worse than others, even younger than others, basically those ligaments get lax, and then you get too much joint play going on. And a big part of PRP, how it helps, is I usually always inject the MCL and LCL. And then usually, one of those is thickened or inflamed, partially torn. so it definitely needs it. But even still, if those are lax on physical exam, I'm going to talk the patient into a few more pokes into those areas. But so for the 50-year-old guy, I don't know what he's been doing. Has he been playing sports? Is he bone on bone? That sort of thing. All those factor in. What's his health status? Does he have type 2 diabetes? Is he overweight? Is he healthy in general? We're using the body to heal. So if we're using the body to heal, the healthier he is, it's going to really help the PRP procedure. Those go hand in hand. So I'd say on average, people like numbers. So on average, yeah, a 50-year-old male coming in with osteoarthritis of the knee, he's going to need 2 to 3 rounds versus someone who's starting to get osteoarthritis in their early 30s. Might do well off 1 round. But, I'd say that's an 80% ballpark there. There are always exceptions to that based on other factors.
No, completely. That's good insight though, because I think people want to know, right? Like, especially if you're getting into this as a key part of your practice, which I know a lot of people here are really inspired to do. They have like sort of the in British Columbia, anyways, the guidelines for training published, and people are choosing different paths all the time. There's like 3 or 4 different paths you can take with sort of newer injection therapies, and it's hard to make that decision. Like, are we going to be doing Prolo? Are we going to be doing PRP? Are we going for recovery? Are we going for aesthetics? What are we doing? What are we choosing? What's next for us? And so I think that's really helpful just to know, like, that's how we can support people. It's like somewhere
Right.
between 1 and 3 sessions, maybe a little more if it's really worse off. And then my second question was about the nutrients. Like, would you be giving vitamin D and vitamin A there? Like, do you have something specific, or are you doing labs every time and going with deficiency?
Right, you're still working with the patient, right? And then what they can afford and what they're kind of, they might have just met you, and they're looking at you like, why is your hair blonde? I heard you were good. I'll see how this goes first
Yeah,
before
right.
I buy anything else from you, Dr. Clark. And yeah, so there's the trust factor coming in. There's the patient's finances. So basically, I am going to recommend they come back and see me for blood work. Most everybody needs the micronutrient testing. I can't tell you, probably at least, I was going to say 9 times out of 10, it's higher than that. Patients have never had micronutrient testing beyond vitamin D, right? Okay, well, B12 could be why you're tired, Vitamin A is probably why you get, if your vitamin A is low, that could be why you're having recurrent, sinus infections or sore throats, more so than normal, right? Every 2 months, that's not normal. Like, what's going on? Well, let's support your immune system. And then, so to get into that, I'm going to recommend you come back, do the hormones. Well, I've already went to another doc. He just shot me up with 200 milligrams of testosterone every week, and that was it. He didn't check your B12 or your vitamin D. Well, that could be why you're tired. That could be also why your joints hurt. Vitamin D is extremely, important for pain levels overall, and it does so many things. So yeah, that's another thing I wanted to get into, like kind of how I do the vitamin protocol. Is it cool for me to go into that now?
Oh my gosh, absolutely. Yeah, we're super interested. I know we all take a sort of a different approach at this, and I hear what you're saying about the patient threshold and the financial concern. It is a big concern. It sounds like you're quite upfront about what's optimal and then what the like minimum effective dosing would be. But tell us your strategy. Go all in.
Yeah, so like I say, usually people aren't going to come in and drop, $1,500, $2,000 on blood testing. So we are limited in how much we're running on the labs. So was saying that my core I can't just run everything for and you wouldn't necessarily want to do that anyway. They're not paying you to necessarily do that. They're paying you primarily to help them fix their chief concerns, right? That's what we learned. So what are their chief concerns? Well, this guy's a lot of people coming in, it's pain. So we're definitely running vitamin A. And then for me, overall health and recovery, I'm always going to run the fat soluble vitamins, vitamin A, D, E, K1, K2. I'm a big Winston Price follower of his work, and basically how he traveled around, and the fat soluble vitamins were basically very paramount in the overall health of the individual tribes that he studied back in the early 1900s. And so I'm always going to run those. And if you look at each one of those vitamins, vitamin A, immunity, skin health, eye health. Vitamin D, bone health, immunity, so many pain levels, energy. And then vitamin E, all the cardiac health benefits. K1, K2 is the one that a lot of doctors are still kind of fuzzy about. They don't really understand. Still, even some naturopaths, we learn this, but I feel like people forget difference in K1 clotting and then K2, as we should couple that with, and Vitamin Lab even talks about that in an email I saw, coupling those together and how important that is for bone health. So vitamin K2 directs calcium into the bone. And to me, if the body's not getting what it needs, it's going to be more stressed. And the PRP, it's just like, we got all this stuff going on, and you want us to focus on all these platelets you just put over here. That's a stressor. Yeah, we'll deal with it, but it's probably not going to be optimal. So the B vitamins come in, essential for energy, for the body to be able to do work. So I run all the B vitamins, all the fat solubles, vitamin C, zinc, selenium, magnesium, copper, iron. Iron mainly because a lot of males don't even know it. They have trouble getting rid of iron, not just males, but we don't menstruate every month, as we know, right? So iron can be a big factor for a lot of men. Women too, iron deficiency more common, right, for women. Getting iron right, mainly managing that. And then zinc and selenium, zinc, hormone support, right? Even blood sugar regulation. Selenium, that's actually essential, I found out, for getting rid of mercury. And it can even basically help the lymph system move lymph and basically help that system. Selenium is extremely important as an antioxidant. And so we got zinc, selenium. Copper is actually very important if you have herniated discs. Having a copper deficiency can predispose you for getting herniations. So that one,
That's interesting. I hadn't heard that before.
yeah, and of course, magnesium, big one. We all know about magnesium in the health field, right? How important that is. Blood sugar regulation, muscles relaxing, being able to calm yourself. And then magnesium 3 and 8 we just talked about, for brain health. That crosses the blood-brain barrier is essential for the nervous system. All this stuff comes into recovery, comes into your body's ability to regenerate and heal. So those are kind of like my core things that I'm looking at, and I put in a core formula for everybody. And to me, that's like the foundation. That's my foundation that I want everybody, when we do the blood work and then we see that, you're probably at a quarter tank here, I want you at a quarter tank here, up towards the top. Unless it's like vitamin D, right? We don't want that too high, but that good half to 3/4 level, that's what I'm trying to get everybody at. And then the overall benefits of each one of those vitamins, you look it up on PubMed, it's just for preventing cancer. This one, you could look at every single one almost and see just probably 10 things that it can help with or help prevent, so.
Of course, I'm so interested in like optimal performance. I mean, we get so many athletes coming through who are looking to, be the best in their field. And I was there, I was playing varsity basketball here in Canada. We had some D1 games against United States teams and got pummeled in a serious way.
Yeah.
But we had fun in our league here. And I just remember not feeling optimal, feeling like there's something missing, like feeling like I'm putting in the work, right? I'm putting in the time. I'm training in a way that I'm being told to train.
Right.
And, maybe it's simply my physiology that's preventing me from reaching this status, but like I literally can't train anymore. But now talking with you and thinking about how my athletes are doing, I just wonder if there's something that could have been found out by a naturopath, right? Like something that we could have discovered. Tell me a little bit about if you think the same, and talking to your young self as an athlete, what would you suggest? How would you direct yourself to become more optimal and a higher performer?
Well, that goes, the vitamins, definitely doing the blood work and seeing, how do you know? How do you know how much vitamin D you need to take? You don't until you test. Everybody's different too. Your buddy could be taking 10,000 IUs a day. You might need 15, hey.
I want to run that test for a whole team. I mean,
Yeah.
it'd be so cool. I was talking to a guy earlier this week, and he was doing like genetic analysis and population-based data for deficiency. And we were talking about vitamin A, right? It trends with vitamin D, but we're testing vitamin D so much. Vitamin A trends with it. And then I was thinking about the magnesium being deficient in the soil and how many of these nutrient tests I've done and found other minerals deficient. It's like it can't be so simple as to just give everybody magnesium. It would be so
Right.
amazing
Yeah.
to give this test for everybody.
It's like, yeah, and it feels like it's getting worse all the time, you know. Just, I mean, yeah, I don't know hardly anybody that I test that's not on vitamin D that their vitamin D is good, you know.
Right.
And
Even in
magnesium,
your region.
yeah, magnesium too, right? Yeah, we're in the sun, and so it's crazy. It's extremely important up there, yeah. And so yeah, I guess if I could go back and talk to my younger self, I mean, that would be a lot of things from like performance. Guidelines there, and then I didn't know about PRP there, so I had shoulder surgery on my labrum in 2007. I just kind of grinned and bared it, as we call, right, for about 6 months,
Oh,
and
brutal.
I could have went and got PRP and maybe avoided it because it just kept getting worse. I kept tearing it more and more playing college football. So yeah, I would have definitely, yeah, I would have loved to have strength doctor. Let's just put it that way. That's a shameless plug. No.
No, come on. That's what podcasts are all about. Like, like, do you think that PRP is a part of regular collegiate medical programs?
It's becoming more common, but
Nice.
I wouldn't say it is common by any means. No.
You think
And
it's
then,
picking up?
I would say more definitely the professional athletes. They usually have a orthopedic doctor, or even their surgeons starting to do some of that.
Cool.
So yeah, I don't think they still have it as a front line. You know what I mean? Like they might tell you about it if you're like, under no circumstance, doc, am I going to have surgery, and then they'll be like, all right, well, let's try. You ever heard of PRP?
Yeah.
Like,
Okay.
unfortunately, money still rules a lot in medicine.
I hear you. So you'd be giving yourself regenerative, maybe not yourself, but you'd be getting supported
Oh,
with PRP injections.
oh, if I knew how to do it, yeah, I'd give myself injections all the time.
Do you seriously?
Oh yeah,
Oh my gosh, I can't do that.
I gave my hip an injection not too long ago. My knee. Y'all seen the hip? That was interesting. I was looking at the ultrasound backwards,
Oh my gosh.
and I was just like,
Clark, come on.
it was hard. Yeah, but
Oh my goodness. So you do a nutrient test. Would you use anything else in performance? Like, do you have any like go-to? I know that you're doing mostly recovery, but any other sort of interesting things that you would use to support your own performance athletically?
right, something the audience could gather. I always took creatine, so that's a big one. Glutamine's essential after the workout, so you can even take 5 milligrams, what I usually always try to take almost every day, and you could even, during hard training, take up to 20 of glutamine. So those are extremely important. Choline actually is important for neurotransmitters. So acetylcholine, getting the muscles to fire, that's extremely important. Getting the vitamin D right, getting enough vitamin C, so you actually have the levels to be able to support, the collagen reformation after you break it down. Copper, I think, is extremely important too for regenerating, and I'm trying to think. Collagen, I feel like that's more important as you get older, but definitely can't hurt the younger athlete.
Interesting.
Those are kind of my big ones, and then staying hydrated. Are you getting enough potassium? Are you eating your avocados? Are you getting your salt? If you're sweating a lot, you need salt. In general, you need salt, but yeah, especially if you're an athlete, you get enough salt, potassium. Clearly, the other electrolytes are important too, but
That's such a good point.
yeah.
Yeah, I mean, gosh, there's so many young athletes are incredibly dehydrated, and they're not taking care of their hydration status. We've been measuring it here in the practice with the in-body scan, thinking a lot about hydration and performance. And recently, I was reviewing some data, some research about electrolytes and their ability to help performance, and it's out there. Right? Like it's ridiculously important to stay hydrated. I remember we had Canadian Division I basketball tryouts during Frosh Week. So everyone's incredibly dehydrated, right? Because everyone's, you're 17 and you haven't been to university before, and everyone's enjoying themselves, and everyone stays up all night and then goes and tries out. Everyone's incredibly dehydrated, and it reduces performance significantly.
Yeah, and you're just going to get injured eventually, so yeah.
Yeah, it promotes
Yeah.
injury for sure.
Yeah.
For sure. It's a really good point. Thanks for that, Clark. So
Hmm.
so hydration status, I think thanks for taking us down that road. We had a good conversation this week about the different types of magnesium and other minerals and how to facilitate absorption. Are you doing any of that work in your practice? Are you thinking about absorption, digestive function, types of nutrients?
I did do IVs for a while. We've kind of basically now I kind of refer out for that if I suspect somebody has like GI issues. A lot of GI issues or difficulty absorbing certain nutrients. I'll refer out to intravenous therapy. That way we know they're getting those nutrients. But
Mhm.
yeah, I guess it's all about you can't do it all. But I actually have on the website basically if someone comes in, they're like pre-existing medical conditions. Well, I have basically IBS or whatever. I will recommend. Have you done a food sensitivity panel? Have you done? We also run. If it's something, I'll ask them a little bit about that, right? Because the gut opens up, as we know, to everything, right? And if you're not absorbing your nutrients, everything's going to suffer. Your gut's inflamed. So I will try to get to the bottom of that. Food sensitivity, I always run that too if they're willing to, do that part of that's in my core package there. So the 96 foods from Vibrant, I'll run that and then see if that's off the charts, right? And some of the stuff they're eating every day, then I'll recommend if it's like real, it depends, right? What's going on? If it sounds like something real bad, so that's not optimal, I would say, in my practice. And I'm always, I like talking to folks like yourself and other docs about how I can further help my patients too. And I think honestly, we get into a mode of like me doing PRP, me doing hormones and that sort of thing. And, those naturopathic core principles are extremely important to remember as we're moving forward. But like I say, I will mention I do stool samples as well. So if I think parasites are actually, to make this conversation very interesting now, way more common than people think for GI issues. And I think, yeah, that I do have those kits that people can take home and then send that off. So, but
Yeah, they can provide so much value, those tests.
yeah,
We catch a lot of them too.
not just the parasites, but like, right? I mean, through Vibrant, I did that for me. And then, you have like the bad bacteria, and then these certain strains are too high, and then these good bacteria are too low. This is what's recommended supportive wise to basically do all that. So, and all that stuff adds up, right? That's kind of what I'm saying.
Yeah.
I'd say most of my patients are mid-income level, and then sometimes we get, people from Scottsdale that come down and they're like, Dr. Clark, I want to do everything I can for my health.
Mhm.
And clearly, if they've got bowel issues, I'm gonna, recommend all these sorts of things. So
Yeah, love it. Love it. There's so many good opportunities out there for optimization. It's so fun to be doing this every single day. Are you doing your own physical therapy or do you have a team? Like, are you referring for physical therapy after injection or are you giving the suggestions to the patients?
I'll give them a few to start with, like a video, but I do recommend. I was like, one of the most important things about physical therapy is that you actually do it. So I usually recommend, I'll say, where do you live? And I have that on like their patient information sheet. And then we'll look, if they're not already doing physical therapy, I'll look on their area to try to find a good physical therapy office around them or have them look, right? Somewhere that's workable, feasible for them to go to a couple times a week. And some patients, clearly, even though I'm cash pay, still have insurance. And then I'll be writing a referral letter to try to get that part covered. But yeah, that's extremely important that they find somewhere near them, has good reviews. That's what I tell everybody. Hey, find somebody with good reviews. And because, yeah, that's important. Getting good people. It's like anything, right? Your circle around you is extremely important. And this is your health, guys. So I don't do physical therapy myself. I might give them a video. I might show them a few things. But basically, I'm not a physical therapist, so I want them to go to the licensed professional in that area and show up and do the work. Strength doctor will call you out if you don't do the work.
There you go.
Hmm.
There you go. For our listeners here today, Clark, we've learned so much about your practice and how you're supporting athletes. Tell the audience something about yourself that maybe your patients don't know, that might just encourage a little bit of individual thinking.
Well, last year I sold my home and I literally moved to Mexico for a while.
Okay.
And within that process, I've actually got I'm building a house in Mexico right now,
Nice work.
Airbnb, and then we're looking at doing a fishing charter. Hopefully, starting that next year sometime. But I was saying
Ah,
that
cool.
I am a permanent resident of Mexico now. I started out
Wow.
I did the temporary resident, so I'm a Mexican, guys. All right.
Good for you. That's so cool.
I started out as a temporary resident, and then now a couple weeks ago I got my permanent residency, and then it'll be a little while before eventually I'll become a citizen there. I got to pass my Spanish test and some other stuff, but yeah, I'm a permanent resident of Mexico. And I would say another thing is I started playing the guitar this year, so I'm excited to basically I'm putting things together there, so I can start actually playing a full song.
Nice work.
Yeah,
Physician,
acoustic.
heal thyself. Have some interest. My gosh, that's so cool.
Mhm. Yeah. What about you?
Awesome.
I guess
What about me?
you've done this, yeah. Not that maybe you talked about earlier this week with other docs, but something I don't know. Or
Something you don't know about me. I was a naval officer in the Canadian military.
oh, really? Awesome, man.
Yep. There you go. It's part of my identity, part of my background. Yeah, I went to Royal Military College, and very similar to your Annapolis and West Point and Air Force.
Awesome.
And that's where I did my undergraduate degree. And then I went into the Canadian Navy as a naval navigator for a few years.
Awesome, man. Est-ce que tu parles le français?
Oui, je peux parler français. Oh man, you can speak
Un
French. That's
peu. Yeah.
amazing. Amazing. No, my kids are in bilingual school, and in order to be a naval officer here, you have to be bilingual.
I thought so. Yeah, the Canadian French Association.
There you go.
Yeah.
There you go. I'm interested to know what you think about trends in the industry. What about regenerative techniques, regenerative IVs, trends in recovery? What do you see coming up in the future for docs like yourself?
Well, the whole thing's AI, right? So how's that going to factor into everything? That's the question of the future for probably every field, right?
Hmm.
It, I The hydrotherapy, that's interesting. I was talking about this with my assistant earlier, and we were talking about how Instagram and social media has changed everything, and people are getting health advice on Instagram. Back when I started, they weren't really doing that. It's like you went on Instagram and you were looking at photos, you know.
Yeah.
So I think social media in general has changed the landscape of healthcare. A lot of people are getting a lot of advice from Paul Saladino or this and that, supplement advice here and there. And then along with that, there's the hydrotherapy. There's a lot of people are seeing people. Joe Rogan's telling everybody to go out of the country to get stem cells, right? And then the sauna, the cold plunge. At my other office, it was actually a home office. I had a barrel sauna in the back. It held 8 people, and then I had a hot tub that basically we would put Epsom salts in, and I would have health parties basically where people would come over. A lot of the Olympic lifters I was working with and their gym would come over, and I'd cook out, and it was a lot of fun. It was a lot of work, but
For sure.
it was a lot of fun, doing that sort of thing. So I have experience in that area, and as far as like where it's going to go, I'm not so sure. I just think, like people are doing cold plunges in their garage now, or they're doing sauna in their garage. So maybe we see more of that sort of thing. People aren't reaching out to necessarily naturopaths to do, but I still think at the end of the day, like that's kind of what I feel like our medicine as naturopaths is cool, and it's kind of like a smaller knit community that like people really like, and I hope that doesn't go away. My answer to this, and that people don't just do everything all on their own, but it's fun to talk and be with other like-minded individuals that are working on their health too. So I hope it continues in that sort of a direction, but I don't know. Who knows? Like, right?
Definitely.
Who knows?
No, I think that's really well put. Yeah, I think it's really well put. I think you're so right about the social media influence, and then AI is next, and who knows where that's going to take us? Probably somewhere completely different.
Yeah, I guess we better accept it sooner than later.
Maybe.
It's
Maybe.
here.
Well, listen, Clark, we're really grateful for your time today. It was such a great chat with you. Where can our viewers learn more about you?
So my website's www.strengthdoctor.com. And basically, I'm in Tempe, Arizona. So if you're in Arizona, would love to work with you. Even if you're not in Arizona, I can do some telemed. And the company I work with with blood work, we can ship kits anywhere in the U.S. So basically, I can work with them to do work with Vitamin Lab. So get them going with their own personal tailored formula with Vitamin Lab, and then yeah.
Great. Thanks so much, Clark. Hope you have a great day. When next year when I'm down in Arizona, I'll have to hit you up.
Sounds great, man. Thank you guys very much.
See you.
Have a great day, man. Thank you.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.